They filtered.
Sounds great. Okay. I'll go ahead and kick it off then. Thank you everyone for joining. This is a pretty informal presentation of what MCI's 2026 funding efforts are going to look like. The announcements are out on our website now. I can direct you to those. But what I'm going to do in this presentation is kind of give you a high level overview of what our funding efforts are, what sort of eligibility we're talking about, what sort of projects we're looking for each individual efforts. And then talk a little bit about what makes a good application and what sort of things we're thinking about during the evaluation process. This is going to be pretty informal, and I imagine we'll have somewhere in the neighborhood of like 40 minutes for Q&A. So think of your questions. Please post them in the chat. You can raise your hand, whatever's fine. I'm happy to address things both as we go or at the end. This is, again, just something that's intended to be a resource for all y'all to understand the best way to get a good application in, right? A good application is what we're looking for. We're looking for things that can ultimately translate to contraceptive development. So, with that in mind, I'll go ahead and get started, and I'll start talking about first and foremost just the big picture, right? Okay, so MCI, you might be aware, has multiple funding streams, funding tracks for different approaches, positions in the development pipeline, all sorts of different angles on the male contraceptive space. And so, what we're looking at this year, we have four specific funding tracks that I'm going to call out in detail. But we also have a couple more. For example, our trainee success program, travel grants for young investigators is something we also do. I'm not going to talk about it a lot in here, but just to say that if you're interested in that, please let me know. We can have a conversation about it. The main thing that we're going to cover right now is talking about the annual grants cycle. So MCI, as you are probably aware, has been making grants in the male contraceptive world for 7, 8 years now, and we have generally let that take the form of an annual cycle where we call for applications, evaluate those applications, and make awards based on that. The uh, scope and scale of the funding effort has changed slightly from year to year, but this year what we're looking at is something around a $400,000 project over 2 years for established investigators, right? This is someone who's associated with an organization, an institution, maintains an active research program in male contraception, and is moving a product towards market, either in a academic discovery sense or in a commercial sense as well. I'll say a lot more about this application in a second, but the thing I want to make sure you take home with it is that this is focused on translation. This is focused on product development. We're actually trying to get contraceptives to market with this funding mechanism. We're obviously aware that we're talking about $400,000, and we're not talking about you know many hundreds of millions that can support later stage clinical trials. But obviously, with our capacity and with our interest, this is a place that we feel like we can make a difference. Um, Another grant program that is new this year is our Focus Grants. This is a relatively, well, it's a completely new program, but it's been envisioned as a way that MCI can put a little bit of a thumb on the scale. We can say that this is an area that we see opportunity in, and we can try and incentivize work within that area. This area is going to be on targeted degraders, PROTACs, right? Proteolytic targeting chimera, right? We're talking about instead of small molecule inhibitors, we're talking about chemical modalities that can degrade a contraceptive target. There's a lot of opportunities in this space, I think, as far as contraception goes. I'll talk a little about why male contraceptives, I think, are uniquely suited for PROTACs. But just to say that this is a bottleneck that we think we can try and attack. This program, we're talking about a shorter project period. We're probably talking 12 to 18 months, depending on the individual application. And then we have a range of potential award amounts depending on the individual project needs. So that'd be 150 to about 300K. Again, that application announcement is available online. I'll go into some more detail. Another program that we haven't put out on our website, but we've talked about publicly in some ways, are agility grants. These are intended to be very small, rapid grants. We're thinking about ways that we can solve specific problems, very discrete experiments that can open up the door for something larger. We're talking about projects that are somewhere in the neighborhood of 50K or less in this funding effort, and then have a project period of less than 12 months, right? This is designed to be feasibility, rapid cycling, trying to get proof of concept and move forward from there. Um, the other thing that I'll talk about too, which I think is near and dear to my heart as well as many as yours, is our fellowship program. Obviously, we're very interested in getting products to market, but we also know that the male contraceptive research community is something that needs to be expanded, needs to be supported. And so we provide fellowships towards graduate and postdoctoral researchers working in male contraception. The scope on this is slightly broader, right? I talked about annual grant cycle being more focused on product development. The fellowship cycle can be more focused on, basic science, target characterization, things that maybe aren't eligible for some of our more investigator-initiated or later stage awards. But regardless, we think that this is something we need to do to help build that pipeline of investigators. And obviously, we all know that the graduate students are the ones whose hands are normally doing the work. So, with that in mind, I'll get into some of the individual applications and some of the individual announcements. And I'll start with the big one, right? Our large request for applications, our core funding cycle. So I mentioned it's 400K total. It's got a 2-year project period. Some key dates are here on this slide. So letters of intent are due May 30th. I'm gonna walk you through the process real quick. So we're doing a letter of intent this year to try and manage the volume of applications that we get in. And this is designed to allow people to pitch a project in 2 pages or less, provide us some specific aims, give us an idea of what you're going for, such that we can evaluate and say, like, all right, this is a good fit, or maybe like this is a good fit, but maybe it's not competitive. There's a lot of things that we can do to try and help triage the initial influx of applicants that way. Letters of intent will be evaluated by our research committee. And then from there, 10 applications, plus or minus, will be invited to submit a full 6-page research application. Those will be due August 30th and then evaluated in a peer review process from there, with awards being made somewhere in December. Projects start somewhere in like Q1 2027. The thing I want to emphasize with this funding effort is that we're really looking for, like I said, translation here. We're looking for an idea that is moving towards commercialization. And when I say translation too, I don't mean specifically like starting animal studies or getting into the clinic. I mean specific milestones that I see as associated with translational development. If you look kind of on the bottom left-hand side here, I've listed some things that I see as significant translational milestones, right? Big inflection points in the life cycle of a project that allows the development of either ongoing applications, new funding streams, right? These are big moments that de-risk a project tremendously. And so things like lead identification of a lead series or in vivo proof of concept, generating a development candidate, something that's going to enter regulatory enablement, IND filing, right? Getting that actual paperwork done to get to first in human. And then, of course, dosing first in human, right? These are big translational milestones. I think that if your application focuses on achieving any of these milestones, it's good framing. There are, of course, many other milestones in between these, around these. I'm also talking about drugs here. This application is open to devices as well. So just to say that this is not comprehensive, but I hope it gives you an idea of the sort of things that can make a good application, right? We're talking about things that can um, incentivize other funders to get into the space, can provide real value for a program. On the right-hand side, I've got this thing of kind of what we imagine getting. I wouldn't say this is what good looks like, because good can look like many things, right? This is not a prescriptive or comprehensive idea of what the sort of applications we might get would look like. But if I just think about the sort of things that could come in, I think it's very reasonable that a group that could come in with a validated target, some compounds that they're working on that have some sort of data around structure-activity relationships, and then they have a plan to get to that in vivo proof of concept in an animal model. That's an application that I see most years, depending on the specific target, the investigator, et cetera. That would be a pretty classic fit for this mechanism, especially if we're talking about an academic source for the application. I will say though, things that are not a good fit, right? Things that don't have like that next step of how do we get this thing to market, right? If you say I'm working on this target, it's a validated target, I want to understand more about its mechanism of action. Very good, probably very important, but in terms of this grant, we're looking for what's the next step? How do you get this moving towards a therapeutic in the end? And then the other thing I'll mention that things are not a fit. We need projects to have some measure of validation. And what we call validation in our RFAs, we split it up into two different categories. We say that you have to have proof of concept in this, is what we define it this way. And we accept both genetic and pharmacological validation for targets. So that can be a knockout with infertility. That can be a compound that demonstrates infertility in an animal model. There's a couple of different definitions. I encourage you to take a look at the RFA and see what you can see. But that's something that we lean pretty hard on as a way to make sure that this will actually translate into a product that people can use, right? We need that preliminary evidence that this is actually going to work as a male contraceptive. I should also say when I talk about infertility in an animal model, we're looking for infertility, not subfertility. That's a challenge that, it could be that the animal model is not a good representation of the human, and the human context would have infertility, but obviously, we won't know that until we get into humans, and we do need good animal models to do these preclinical studies. So that's a bit of a line that we've drawn, but take a look at our validation criteria and our application if you have any questions, or reach out to me. Um, what we'll move on to the application page from the um, LOI stage, I think that there's a lot of things that bode well for people, right? If you got good preliminary data, if you're an investigator that's been working on this target or in this space for a while, right, those things will always be a nice leg up, especially with external reviewers. But within MCI, I also think that we really want you to have a clear target or a mechanism, right? How does this thing work in terms of making a male contraceptive actually happen? What are the effects on sperm? What are the effects on other cell types? Obviously we have different approaches here. I can't be comprehensive in how I'm describing this, but just to say clearly delineating how your approach is going to lead to a contraceptive for human men, right? I think that's very important in these applications. Um, Another thing that's very important is your milestones. When you lay out your application, I think it's great when people include go, no go criteria or specific, we will achieve X by this date. It's very good for us to help us evaluate grants. And not only that, it allows us to know kind of what we think is possible. So those are good criteria, good things to include in applications. But another thing I'm going to talk about here is this second to last bullet from the bottom. It's a translational development plan. This is a new piece to some of our grants this year in the application. If you look through the announcement, you'll see it kind of towards the bottom as an appendix. This is independent from the actual research plan. But within there, we ask people to outline a number of criteria, plans, assumptions, things that you think are relevant for actually, again, getting this thing moving into market. There are many of these questions that I think academic investigators or people who are not strict product developers may not have at the top of their head. And I think that's okay. We want people to think about this as the best of their ability. Some of these questions in the translational development plan, I'll say, are more relevant for later stage projects that are approaching that sort of milestone inflection points of maybe a development candidate or regulatory filing. But at the same time, I think it's very good for anyone thinking about a drug-based modality, especially to have these sort of things in mind. Last thing I'll mention as far as the 2026 RFA goes is continued grants. As you know, MCI has made grants for many years now. We have not yet had a mechanism to uh, continue funding, after a grant finishes its original objectives. We've had people reapply through the cycle. And that's what we're continuing this year. But we are trying to put a special dispensation for continued grants, such that you're more likely to get through the LOI process. It's not a guarantee, of course. We've said that we're going to accept somewhere around 10 LOIs for full applications. But this is something that we want to incentivize. We want to incentivize our grantees to continue applying and continue those threads. So. Okay, that's the big RFA. You can see again those applications are online. Excuse me, the application announcement is online. You'll apply through Proposal Central. That's our third-party application platform. And if you have any questions on that, of course, reach out to me. My email is at the bottom of like all these slides. Hit me up. The next thing I'll talk about is that focus grant, right? The new funding effort that I mentioned on PROTACs and targeted protein degradation. This has a 300K up to 300K award amount, as I mentioned, and I listed previously that this was a 12 to 18 month project period. I'm sorry, I think that if I look at our actual RFA, I gotta make sure that I got the right number on this. Yeah, sorry. We're in the RFA we say preferred project period is 12 months and projects up to 24 months may be considered with justification. So just to say that 12 is what we're looking for, but if you have good reason, we can include that in an application and justify it. You can see the dates here. Applications are due June 30th. There is no letter of intent process for this. You will apply through Proposal Central. You can submit a full application. Award announcements are expected somewhere in September, which makes the start date, Q4 is possible. Q1 2027 also possible. We can generally be flexible with start dates depending on the investigator needs and kind of our own timelines. But just to say, one of the things that I think is important for this RFA is to call out the three individual tracks. So, of course, this is a targeted announcement. This is not broad scale. Where do you sit on the development spectrum? But we're looking to accomplish individuals' objectives here. And the first one is making new PROTACs against individual validated male contraceptive targets. Um, if you have a program where you are trying to um, degrade a specific target and you've already got some kind of chemical modalities, maybe these are binders that you haven't yet linked to E3 ligase recruiting elements, things like that. I think that this would be a good fit for that investigator, right? Trying to actually develop a PROTAC, improve its properties, see what happens with the goal of moving towards maybe an in vivo study. But we also have two other tracks here. And importantly, I think that we need to talk about the relevance of PROTACs and degradative technologies for male contraception, right? So, big picture, right? Male contraception, many targets, spermatogenesis, sperm motility, right? There's all sorts of different mechanisms by which you can theoretically push towards a contraceptive. Those targets though all have their individual challenges, right? If I use a motility target, for example, right? It faces what we call the dilution problem. You dose a man has drug in his system, the target's exposed to drug, but then the sperm are ejaculated, right? And they go into a drug-free vaginal environment. Does the drug dissociate? Do sperm regain motility? These are all things that need to be assessed clinically, but with a PROTAC, it might make a little more sense to degrade the target rather than inhibit it, such that there is no target, there is no restoration of motility. This also enables some unique product profiles that have like other than daily dosing. It's very reasonable to kind of imagine a PROTAC based approach where um, a user would take a drug, have an onset time measured in hours, maybe days. It's hard to say at this point exactly, but point is a relatively short onset time, not the 3 months for like a spermatogenesis inhibitor. And then on top of that, you would have kind of a long tail in theory. If you degrade all the active protein, sperm are transcriptionally, translationally silent. We would then uh, have a long return to fertility while those incapacitated sperm are moved through and out of the pipeline and new sperm are generated. And so this enables some unique product profiles that I think are important for contraception, and further than that, I think that they could be very effective technologies, right? So, with all of that said, there are challenges to PROTACs, right? They break many of Lipinski's rules. They're big, they're bulky, right? They may not pass through different barriers to get to the targeted site of action. But I think that we can do some work in the reproductive and contraceptive world to identify what might actually make a good approach with regards to a PROTAC. And so this second track is characterizing testis and sperm specific E3 ligases that could then be conjugated and form a complex and induce degradation with a target of interest, right? And so we're looking for in this track not just identification of the ligases themselves, but where is their expression? Where's their localization? And we're also thinking about how does that pair to individual contraceptive targets, right? If you have something that's present in the sperm tail, but the ligase is present in the head, you're not going to get it. And so we're trying to think about how we can match a ligase to a target and maybe make something that not only has nice tissue specific expression, but also very tissue specific degradation, right? That can really enhance the not only the off target profile, but the maybe even the efficacy of a product. Last thing that I'll mention too for the eligible tracks is, of course, discovery of new recruiting elements for those E3 ligases, right? If we define a new E3 ligase that is capable of degradation and there aren't any chemotypes that can be plugged in, then we'd like to find some more of those. So just to say that those are the tracks that we see as relevant for developing pro-tax against male contraceptives. And what we imagine getting in this space is, something where someone has a program that they're trying to pair with a reproductive biologist. We think that it's important for someone to have some sort of chemistry or degradative experience here. And I should say too that I know a lot of people don't have these assays in hand set up in their labs to measure degradation of protein targets. And so, what I think will eventually rise to the top for this funding effort is obviously people with some preliminary data. I think this is an area that doesn't have a lot of data. And so, if you have some that can prove that you're on the right track, then I think that goes a long way. And then also a clear target and established mechanism, right? When we talk about contraceptives and degradative technologies, that target validation still exists. We still need to know that degrading that target will have an infertility phenotype. And then two, I mentioned the expression and localization of the target and the E3 ligase. I do think it's important that applicants be thinking about that. And if you don't have a set of data for why your E3 ligase matches well for your target, then I think that data is really helpful. Um, One thing I forgot to mention that I should is also, I know there are folks that are thinking about broadly expressed ligases. I'm thinking about cereblon, for example, right? Um, Totally possible for that to be used as an E3 ligase, at least as a preliminary way to demonstrate degradation. But obviously, we are working at contraception here, and I think that a lot of the E3 ligases that are out there, obviously ubiquitously expressed. We would be looking for things that maybe would have more targeted expression and degradation. But two, the chemotypes that are used to recruit cereblon, right? It's thalidomide-based molecules, and it's hard to say exactly what the effects of a thalidomide E3 recruiting element would be in a protac when it's connected by a linker to a much larger molecule. But just to say that we're all aware of the effects of thalidomide in the reproductive sciences, and I think that it's very important for us to consider what not only the regulatory questions that would come up for something like a thalidomide-based PROTAC would be, but also the public, right? I think that in the end, contraceptives face quite a bit of public scrutiny, and if someone makes that connection to thalidomide and contraception, it could scare some people off of something that maybe isn't necessary. So, anyway. The last thing I'll say too, what will rise to the top, people, I mentioned people a lot of times don't have these decorative platforms established in-house. If you can have that, if you have that as preliminary data, that's a big step up. Okay, next one. The agility grant that I mentioned, right? This is our small dollars, investigator initiated, pretty quick turnaround grants. Um, we have a budget, I mentioned around 50K. I'm saying anywhere from 10 to 60 in this slide. And that ambiguity is actually kind of on purpose, right? If you look in the application announcement, which I can share with anybody that's interested, it says that applications proposing budget numbers beyond that figure must provide significant justification. We're very interested in funding things that are quick turnaround, small dollars, high reward, right? Maybe high risk, but I think that's okay for this mechanism. We're also thinking about things that maybe aren't ready for a focus grant or the big RFA, right? Things that lack that sort of maybe target validation or target characterization, things that other programs might have. Um, I think that other things I want to mention here are there's no LOI required. This is a pretty short application, pretty short turnaround, and it has a wide eligibility scope. We fund R&D, of course, from validation all the way through clinical studies in this mechanism. We're thinking about big tools and assays that the field could use, so it doesn't even have to be um, focused on developing a specific contraceptive target. And we also look at possibly funding behavioral science or advocacy and policy through this mechanism. It's a pretty wide window, but I will say that people are encouraged to have a conversation well in advance of submitting something. I think that this is something that um I think this application requires right fit, right time kind of moments. So just to say, if you have any questions on that one, please email me. What I think we imagine getting for our agility grants are, like I said, these quick turnarounds, right? A team that needs one in vivo experiment to justify an application, or like a repurposing idea that just needs proof of concept. You've got a drug, you just want to stick it into a mouse and see if it works. This is something that makes sense. The things that really bring things to the top here, or at least make us think hard about them, is a sense of urgency, right? A defined deliverable, a short timeline, and maybe there's an application cycle coming up, and the data that would go into that is really important, and it just needs a little bit to get there. That's somewhere that we can help. Things that are not a fit are big applications, right, with a lot of work. If you need a whole team, this is not it. Um, yeah. Okay. The last program that I'll mention, this is of course one of my favorites, the fellowship program. So the deadline is June 30th for the fellowship program. Oh, and I'm sorry, I didn't mention for the agility grant, this is a rolling application deadline. So there is no end date on it, but we also have a yearly budget for it. And when that budget is gone, we're done accepting applications until the next year. So with the fellowship program, again, we have pre and postdoctoral fellowships, so graduate students as well as people who've completed their PhD or MD. We have put a couple more stipulations on it this year than we have had in the past. So pre-doctoral applicants have to advance to candidacy by start date, and then postdoctoral applicants have to be within 5 years of their doctoral degree. If you are past that as a postdoc, I would love to talk to you about maybe being the PI on an application somewhere, right? We're thinking about independent research tracks with these applications. This is very much designed to help trainees develop their ability to write grants and be specific about what sort of area they're focusing in. And so we really encourage applicants to have everything to do with every word of the application. It's important for us that the hypothesis, the scientific question, the pursuit is kind of their own idea. We intend to make, let's call it, 4 awards here. It's variable. We have a budget for this funding effort, but you might notice that we have kind of two different funding tracks. And so if we get a bunch of applications for the predoctorals and not as many applications for the postdoctorals, we might make a different number of awards. But just to say that we have a budget for this, and we will try and exhaust that budget with good applications from either predoctorals or postdoctorals in the same pool. Um, okay, I'm going to leave this slide up for a while. This is how to apply. You can see that we've got our big RFAs, right? You've got our LOIs, applications, awards, focus grants, the agility grants, right? All the information is here on the screen for you, as well as my contact info, the grants contact info, the actual web page where you can find these funding announcements. And then you can apply via Proposal Central, our third-party platform. The last thing that I think I need to say, I hope it's clear, but just to make sure I say it real loud, is we actively encourage pre-submission conversations. I would love to have a conversation with you about your specific aims, what a good fit is, how to maybe shape it. There's all sorts of things that I think are perspective, at least, that I think I can provide for you. So please don't hesitate to reach out. I'd love to talk about an application to any of these programs and see how you fit in. But for now, I think I'll stop and take any questions that y'all have, either through the chat or raise your hand or whatever you got. see Beth in there. Go for
Morning, Logan. Thanks for all the info.
it.
Can I just have a quick question on the fellowships? Can you give me an example of what you would envision as a strong application for a pre-doctoral applicant?
Yes, I can. I can give you a few actually, depending on the field of study. So, good applications we've gotten from like chemists are people who are connected with a lab that can do some of the reproductive biology expertise. These guys are producing compounds and getting them tested, and maybe it's an in vitro assay. Maybe they're working towards in vivo, but there's a clear chemical rationale for how they will improve the potency or selectivity or whatever properties of the drug itself. Those chemistry applications are generally pretty good. If I take a step back and think about like the reproductive biology or some of the fundamental science, relating it back to contraception is always one of the most important things is how does this inform the development of a contraceptive in the end? How does this contribute to the field? And then on top of that, one thing I didn't mention that I should is that the personal statement in graduate and postdoctoral fellowships is super important. We want to hear your motivations. Why does contraception ring for you? What does this mean for you? I think that's something that we read very carefully to kind of see if um, people are in tune to not just the science, but the reason for why we do what we do.
Perfect. Thank you so much.
hmm I see a message in the chat, which I'm reading. Damon says, let's see here. I don't know if everybody can see. Yeah, I think so. Let's see. Postdoctoral fellowship. How many stipends can be awarded in this call, and what is the expected acceptance rate? So stipends awarded in this call. We have a budget of $360,000 for this call. If you do the math right, so the postdoc award is 65K per year, and so if you work that out, you can fit four of those into 360K. Oh wait, no, I'm sorry. I have to back up and reframe my math. The total budget of $360,000 is for 2-year awards, and it's 65K per year. So I'm sorry, we have, if we swing that back around, like 180K for 2027. And so therefore, if we have $65,000 postdocs, that translates to $130,000 for two of them. So we would probably make four awards or fewer when it comes down to the actual split between postdocs and grad students. It's hard to say. And then further than that, the acceptance rate. I think in years past, we hover somewhere around 25 to 30%. If we make four awards, we're getting somewhere around 12 to 15 applications. But Yeah, I would say that that's probably going to be typical unless something changes this year. Every year we seem to grow a little bit. Every year we seem to find a few more people, but I wouldn't expect significant deviation from that. And then also in this question, it says in the call, stipend levels may be adjusted based on institutional geographic cost of living considerations and consultation with staff. Um, I'm glad this question got asked. Yeah, we've put that in because we've had people applying from low cost of living countries where there are actually restrictions on how much their stipend can be, and such that we would make an award, and obviously we couldn't pay them the full 65K because of institutional or other requirements. And so we've put that in with that in mind, but we also recognize that there are many countries, Europe included, that postdoc salaries are often much more than that. And so we've worked in myriad ways with that. We've accepted applications in the past with shorter project periods, but the full budget amount. But obviously within there, there needs to be some kind of thought for upside and how much work actually gets completed. I would encourage you, Damon, to reach out specifically, and maybe you and I can have an individual conversation about your project and what you're hoping to complete. But just to say, we have made awards in the past with shorter project periods and full budgets. And then we also have that in there as a way to say that stipends can be flexible depending on requirements and situations. Okay. I see another question from Bertha. Which countries are the applications targeting? All of them. I don't mean to be funny about that, but yeah, we accept applications globally. We have not yet made applications to well, many nations, and obviously there's individual considerations per country, and when we're making legal agreements between countries, but we accept applications globally. Yeah. All right, and then Thibaut, I see. Thank you very much for the description of the grants. I was wondering if these apply to salary only and or consumable. Can some of these grants be used for equipment too, like buying a new machine or specific experiments or paying for third-party services? Yes. So I'm glad this is a very good question, and it's dependent on the individual announcement. Fellowships are intended to be used for stipend only, so they do not have carve outs for consumables, lab supplies, etc. This is designed to be for stipend and salary for the individual. However, other grants, obviously, consumables are a big part of any grant budget. Other than that, we do have some restrictions on equipment purchases. I'd have to look it up. I think it's 10% of the total award amount. It's restricted to that. So you can't go out and buy a $200,000 whatever with it. But just to say that we do allow equipment purchases. You can keep the equipment and use it for things other than MCI work after the grant is completed. And then on top of that, you mentioned the third-party services. We actively I don't know if we go so far as in to encourage, but it is normal for people to outsource things to contract research organizations or subcontract to other labs, things like that. No problem at all. We totally like it whenever someone says, I don't have the expertise or the equipment, but I need this, and they farm it out to someone who can. Okay, doke. And I see, thank you. We get, would target validation grants fit the agility grants, or could they be used for core grant applications? Target validation, I think, should really stick within that agility piece. We do ask for the focus grants as well as in the funding cycle, the RFA, the core grant, whatever I'm calling it. We do ask that in that funding effort, you provide proof of concept or target validation with a genetic knockout or some other means of validation. However, if you have something that needs to be validated and it's a potential contraceptive target, that could make for a good agility application. But I reiterate that with any agility application, I encourage you to reach out in advance and we can discuss some specifics. Great. I've cleared the chat. What else we got? Please. Anna, go ahead.
Hi. So thank you so much. So I'm sort of in a social science world. So my PhD's in sociology, and I'm a postdoc at Cornell right now. And I came just to see like what kinds of opportunities might also be in that space. But I'm curious if you have any examples of kind of behavioral science or social behavioral science, if that's something you're interested in. I know it's mentioned on the sort of agility grants, but just if you have any kind of examples of things like that that you may have funded in the past. Yeah, I'd be really interested to hear a little bit more about what those sorts of projects might look like if there is an interest in funding work like that. Thank you.
Yeah, yeah, thank you. Great question. Our forays into like sociology are pretty limited. I'd say that most of the stuff that we funded that isn't like direct contraceptive R&D has been pretty focused in the market research realm. Defining users and the products they're interested in, their geographies, things like that. But just to say that I personally have a tremendous interest in men, masculinities, that the impact of that on contraceptive uptake, how men engage with reproductive services now or don't. I think there's a lot of um, gaps in this space, and so I'd be eager to hear your wheelhouse, kind of where you're thinking about fitting in, and if you have a project in mind. I think the agility grants would probably be the best fit given the scope restrictions in some of the other grants, including the fellowships. But again, I think here we go. This is something I feel like I should say too. Regardless of your fit in the male contraceptive world, I think MCI wants to be a resource for you. So if you're thinking about something that's related to men and contraception, I'd love for you to reach out and we can see where we can plug you in. This may or may not mean application to a funding effort. This may mean all sorts of informal ways we can help you. But regardless, we'd love to have you as part of our ecosystem.
Great. Thank you so much. I'll plan to reach out through email.
Please do. Thank you. Okay, dokes. I got two more questions in the chat now. Where is your organization based? Male Contraceptive Initiative, we are a remote organization, but our headquarters is in Durham, North Carolina. In case you're interested, I'm outside of Houston, Texas. So we are spread across the country, though. And then I see another one. How many of the 10 LOIs do you anticipate funding? Let's see here. As far as the RFA goes, our budget for that, which I think I included in the slide. Let me look to make sure. I did not, so I'm so glad that I got asked. So we will accept about 10 LOIs. We have a budget listed in the application announcement of $1.2 million for this RFA. And so ipso facto, right, 400K budget, 1.2 million will probably land on about 3 applications. That's the target. Speak now or forever hold your peace. Actually, I'll say one more thing. This is relevant, and I didn't go into it. Maybe somebody's curious. Review. Okay, so all these applications undergo different levels of review. I should say that the RFAs, right? I mentioned the LOIs will go under research committee review, and then they go out for external review. That process is going to look like this. An application gets sent out to 3 external reviewers. Folks with relevant expertise, of course, right? Perspectives that MCI is looking for. And those external reviewers evaluate the proposal across criteria that are listed in the application announcement, assign it a score, and then that information goes to MCI's research committee, who also review and score applications. Together, we have a study section like meeting, and we try and rank and prioritize and pick applications from there. All applicants will receive a summary statement with rationale for the decision, pros, cons, perspectives from the committee. That's something we really try to do for every application. The LOIs this year, we haven't really defined exactly what that summary statement's going to look like for LOIs that don't make the cut. But rest assured, we do not want to just say no and walk away. We want to give you rationale, reason for where our priorities are, and how we can improve things next time. So that's the process for the funding, the RFA that's showing on the screen now. The ProTax RFA, it will also have a peer-reviewed study section-like approach with no LOI. And the fellowships, they have a similar process as well. I will say the fellowships, sometimes we don't get 3 reviewers, sometimes it's 2. And then obviously the discussion is not always as focused on the contraceptive development, but sometimes it's focused on the candidates or the supporting environment or their chances for success in the field or what are their interests in a future career. Those things can inform a decision. But just to say that as far as review goes, all of these efforts undergo some measure of external review, except for the agility grants, which go under research committee review. That's something that to make it a quick turnaround and try to provide things as quickly as possible, we handle in-house. Did that raise any further questions, or does anybody have their inspiration sparked?